Hey everybody, it's Paul Barrett with the Modern Medicare Agency. Wanted to talk to you guys out there in Medicare land about how we get paid, right? So a lot of people ask all the time, how do you get paid? You're not charging me anything. How does this work for you? Well, all the carriers pay us commission. Well, not anymore, right? So this is the story, guys. It's getting worse for me. It's getting worse for you out there. Why? Because a lot of these insurance companies feel like they're not making enough profit because of whatever reasons. Overutilization is what they claim. They still blame things on COVID. Whatever it is, I don't really care. They design plans. They design the plans to be profitable. Sometimes they are, sometimes they aren't. But the bottom line is, many companies have decided to not pay agents for most of the drug plans, right? Which is the most complicated part of Medicare. A lot of the Medicare Advantage plans are now cutting commissions. Why is this important to you? Because quite frankly, if you're choosing a plan and you find a new agent, somebody that's desperate for commission or somebody that's not a successful agent, they may put you in another plan that you shouldn't be in. That's problem number one, obviously. Problem number two, you're gonna have less agents to help you, less good agents when they're not getting paid. I don't know about you guys out there. I like to help people and I do a lot of things for free, but when carriers start saying, we're not gonna pay you on all the business from years prior, starting next year, and then we're not gonna pay you for any new business as well, that's a big problem, right? So you're gonna find a big shift in the market soon. A lot of these plans, most of them are PPO style plans, some are HMOs, but you're gonna see a comeback turn of HMO plans. You're gonna see a lot less agents out there to help you, especially when it comes to Part D plans, and you're going to see a lot more bias. Bias is not good for anybody. Choices are good for everybody. Agents should get paid. You should get help. It's very, very important. So why am I telling you this sad story? Because I want you to be aware this year during the annual election period, what's going on. Make sure you speak to somebody. If you do speak to an agent to get help, you speak to somebody that's been doing it for a while, somebody that's unbiased, somebody that does work with several carriers, somebody that's not desperate for a sale, guys. If you have questions about Medicare, you want help, we do seminars, we do webinars, we do free consultations over the phone, and we can help you. We can answer questions without you having to feel like you're sold and worrying about, am I getting the right plan or not? So that's it, guys. Just want you to know, when companies stop paying commissions, it's not good for anybody because they don't have agents selling those plans. When they stop paying commissions, that means that plan is not doing well. They don't want you on there, and they're trying to prevent agents from placing new customers on there. So if you're on a plan that's non-commissionable, or if you're thinking about getting on one and the agent tells you that, you should think twice. Many of those plans, if they get too many clients, they're gonna do crazy things like dump doctors, right? Last year, we had a company in our area that stopped offering commission and the availability of their plan November 4th. And about a week later, they decide to cut ties with Mount Sinai Hospital and Doctor Network. This is after thousands of people have already been enrolled in the plan. So this is the type of stuff that happens with companies. If they don't want you, they're not paying the agent's commission. So if the agent's not getting commission, you're probably not getting a good plan, and it's not a safe plan. That's not just me as a salesperson. That's just common sense, guys, right? They can't get enough policies without agents. They need us. They know that we'll feed tons of people into their pipeline if we get paid. And if they don't pay us, guess what they know? We're not gonna put people into their plan. So that's the main goal, is to get you out of there and off the plan. So just keep your eye out for the non-commissionable plans. If you don't know whether you're on one or not, you should ask your agent. If you don't have an agent, give us a call. We'll be happy to tell you what's going on with your plan. You can reach us directly at 631-358-5793. All right, good luck.